Marianne, you're breaking. We can't hear you. Yeah, she seems to have dropped. Yeah, she seems to have dropped. Yeah, she seems to have dropped.
Songok, she's rejoining in a few. Songok, she's rejoining in a few.
Yeah, let's let Marianne a few minutes to rejoin. I guess she has challenges with the network. Otieno.
Ameenda wapi huyu?
Mike, I think ako na challenges ya network. Tumpe time kidogo.
Ni sawa. Okay.
Otieno, can we have someone step in for Marianne? I think we also have challenges with our connection in terms of the numbers, because it seems like our link can only accommodate up to 500. I don't know that. Yeah, but I think Marianne should be able to join because we are 488. But Otieno, do we have someone who can step in meanwhile? Because it's Otieno pia
She's joining in a moment. Let's just give her like 1 minute or two.
Okay.
For that, confirm you can be able to hear me as I reshare my screen.
Yes, we can hear you, Marianne. Reshare your screen.
Okay. So allow me to quickly just fill this so that we can be able to save. So once the HTS eligibility screening form saves, our patient now can be sent for further testing, and we can start with the HTS initial form to test our patient. So for this, once we open the form, we're going to go through the HTS testing using the 3-tier testing algorithm. So for our first patient, determine again the population type, general population. Does client have any disability? We're going to say yes, which was visual impairment. And we can be able to even specify what it was. If you select others, then HIV testing history. Has the client ever been tested for HIV by HTS provider? We can say no, this is the first time they're being tested. Has the client done HIV self-test within the last 12 months? We can say no. The setting, is the client willing to share results? We can say yes. No. Client has done a self-testing test, we say no. Then the setting where this is taking place is in a facility. The HTS approach being taken is client-initiated testing. They had come purposefully for a HTS test. The HTS strategy that we're using is going to be still NP for non-patients. HTS entry point, we got our patient from OPD, and TB screening has been done, and we realized our patient may be suspected or presumed to have TB. Has patient consented for a HIV test? We can say yes, and now proceed to testing. How are we testing our patient? We're testing them as an individual, and we can start with the first test kit within the OPD or the HTS lab. We can say you can use TrinScreen. Select a lot number for that. Expiry date for the test kit, we can push it 2027 December. The results for this patient, we can say the first test kit using a TrinScreen testing on a 2:3 ratio, 2 drops of blood, 3 drops of buffer, waiting for 15 minutes. The result is going to be a negative HIV test. So when we get a past HIV test as negative, the final results also is going to populate as negative. Then have the results been given to the client? We're going to say yes. Couple disconduct, it is not going to be applicable because our patient was being tested as an individual. Then are we going to refer our patient to any other service? We can say yes, we want to refer them for preventive services because we had gotten a high machine learning risk score, even depending on the questions that we had answered for sexual behavior for our patient. And now we may want to refer them for risk reduction counseling, condom use counseling, post-exposure prophylaxis, prevention of STIs and treatment, depending on how the patient is presenting. So for us, we're going to say, we are going to refer our patient for risk reduction counseling, prevention and treatment of STIs and PrEP exposure, prophylaxis, and we can also have a few remarks where possible and save and close that particular form. So at this point, we're going to refer our patient for prevention services so that they can be able to receive those particular prevention services that we have been able to refer them to. And that ends the cascade for that so that we can now send our patient for PrEP. Now, in case we have a different scenario where our patient is coming in tested using the 3-tier testing, I'm going to select another patient for this. For this one, I'm just going to highlight a patient now who is coming, who has been tested by the first tester and confirmed as HIV positive, again retested by a second tester using still the 3-tier algorithm, and they have been found to be HIV positive, and they have been sent to the clinical consultation for linkage. So this is the particular patient we are going to use for that scenario. So once the patient comes in, from the clinical encounter or the visit, we can be able to tell our patient came in today, they were tested, they were screened for HTS eligibility screening, and they were found to be eligible for testing. An initial HTS form was administered by the first tester who took the patient through testing, and they found them to be HIV positive. They referred them for confirmatory testing to a second tester, and a HTS retesting form was filled. Again, the results were confirmed as HIV positive. And now we want to link our patient to HIV care. So to do that, the system allows us, one, to be able to fill a HTS linkage form so that we can refer our patient for HIV care services. The visit details are going to auto-populate, and then we'll be able to fill the linkage details. Where are we referring our patient? This patient is being referred to this health facility, and the facility will auto-populate the name. Then we need to give our patient a CCC number. I'm going to use this CCC number, maybe 34992. Then we need to determine the healthcare worker the patient has been handed to. We can say Mary. Ada, we can say maybe they are an adherence counselor. Date enrolled, we can just select today. And maybe this will also be the date where we're initiating our patient on ART. And we can be able to give some few remarks. Client, recommended, or client enrolled in this facility for HIV care. And you can save and close the form. So when you do that, we have finished the entire HTS testing cascade, and for this particular patient, we found out that we have tested them HIV positive. So how do we manage them for HIV care within the system? So once a patient is identified to be HIV positive, we need to enroll them to the HIV program, and this is found from the patient summary. We select care panel, where we'll be able to find any program our patient has been enrolled to, or we can be able to enroll them to a particular program. So program enrollment, a patient can be enrolled according to eligibility criteria to any program, and this is based on the age of our patient, the gender, presenting symptoms, and even existing or confirmed conditions. So you may be able to find there are specific programs that male and female clients will be available for specific gender, available for specific age, again, available by presenting complaints, and available by confirmed conditions. So a patient is eligible for HIV program enrollment, and we're going to enroll them for that using the enroll button that will give us the HIV enrollment form. And we'll be able to see the visit date that we're enrolling our patient, the provider who is doing that, the location, and we can be able to save and close that form. And when we do that, we'll find that our patient currently now has an enrolled status for HIV program. So when we go back to the panel summary, now we'll be able to see our patient has been enrolled to HIV. And from this point, we can be able to see some statistics for HIV enrollment. Their current status. For example, right now they have never been on ARVs, so we can also be able to provide ARVs when they start using the edit button for regimen. We can be able to start them on a particular regimen, starting them for this day using a standard regimen, select the regimen line, maybe it's an adult first line, and select the regimen itself. For this particular instance, we're going to select TDF3TCBTG, and we can save. And now we'll find our patient now has been started on a particular regimen. Now, for us to be able to offer services to this patient and to manage their care and document them, the clinician or the clinical team will be able to access the clinical forms and access now the particular forms for managing our patient, for example, the HIV green card and all the other screening forms, ART preparatory forms, screening forms that will be available on request or when they are due. For example, screening for cervical cancer, for PHQ, depression screening, and the likes. Then again, during care and management, our users may also want to have specific notes when they are managing our patients. They'll be able to use the icon for additional notes so that you can be able to tell for each primary diagnosis that maybe our patient has. For this instance, our patient is HIV positive. They may also have another secondary diagnosis. They may have some infection. We can say maybe HIV bacterial staging infection. We can be able now to note particular treatment plans for the diagnosis and even the management using now this other.
Marianne, allow me to interject. You may need to move a bit faster because of time, kindly, Marianne.
Okay, I'm almost finishing up using the visit notes. Then during the care and management, when we either want to confirm the diagnosis, we will be able to perform particular investigative functions using the order basket, where a clinician now will be able to order for a lab test, order for an imaging test, even order for a particular procedure using this particular section, and also be able to give or manage our patient using drugs by adding these particular forms so that you can be able to load drugs, load the drug orders, which will be shown within this particular next session. So that ends the section for clinical management for our patient, either one who is tested HIV negative or one who is tested HIV positive. For this instance and for this case, our concern will be more for now the prevention measures we're going to take for the patient whom we identified as HIV negative. Now, to quickly highlight the other sections for this particular training, I'm going to invite Moses. Moses, if you can hear me, you can proceed.
Yeah, thank you. Thank you, Marianne. As Moses is preparing to share his screen, one quick announcement. We apologize. We noticed that the link we're using could only accommodate 500 packs. So we've shared a link on the wall, a YouTube link. So kindly share with the rest of the other colleagues. They can also be able to follow our training, and we sincerely apologize for that inconvenience. So Moses, take it up.
Thank you, Songok, and good afternoon, everyone. Please, Songok, confirm that you can hear me.
Yeah, loud and clear, and I can see your screen. Proceed.
Thank you. I'll want, in the interest of time, just to be brief. So my interest here today would be to just build up on what Otieno and Marianne have already, on the foundation that has been laid by my two colleagues who preceded me. So, but my focus will be just to try and induct everyone who hasn't probably had the opportunity to interact with the new version of TaifaCare, the DHA version, just on how to navigate. I mean, the lab orders, and also if we're having any lab personnel in the call, how they'll be able to just update their results. So I should be done in about 4.5 minutes, and I'll really want to be brief. So I want again to ride on the patient that Marianne had started working on. So I'll come to my EMR and then just search for Thursday. So assuming that I'm that clinician again, I want to make just to place an order for this particular patient. Thursday. So Thursday training, Thursday prep training. Sorry, I've gotten, yeah, the one with an active visit. All right. So I'll check, because they already have an active visit. I'll not need to check them in. But by and large now, assuming that I want to probably place an order, one thing that I'll want all of us to note is that with the new release, there has been some change. Those who are probably utilizing 19.22 and previous versions, as much as you're probably on 3.x, you realize that the workflow for this particular version we've really tried to streamline it just to reflect your operations at any given healthcare facility. And that's the reason why, things such as the queue manager had to be dropped in favor of, just the workflow that suits a normal and a typical patient flow. So having said that, I'm sure the patient that Marianne was working on is still probably in the clinical, one of the clinical encounter. Sorry, I've already picked them. So I'm sure they're still in from the queue. I can see they're still actually on OPD, actually in OPD consultation room 1. So as a clinician, what can I do to just offer probably if in the event I'll need to request for any investigation for them, especially from lab. So the diagnostic feature has been disaggregated just to have lab orders and radiology and imaging as separate, as opposed to what used to have. All of them were in the initial versions had been lumped under diagnostics. So for my case, I'll just come to lab orders, and when you click on lab orders, like Otieno again had alluded, if there were any tests that had been done for this particular patient, you will see them under the orders. If there were any orders that had been requested, you'll see them under orders. So there's this tab called orders. And then if there are any results that have been filled over, have been provided by the lab team over time. Again, all the results will appear here. The reason why this was done, the reason why this was changed to, look like this is so that, to just improve on the availability of tests. We all understand that it's very critical in healthcare to avail as much information, even if it is historical, and to the users, bearing in mind that we are now living at an age where the EMR is no longer a health record officer tool, but a tool that is used by the healthcare worker. So for that purpose, now that there's there's no result or orders for me, how do I create orders? So when you go click on the orders tab again, I'm still able to click on the order for my lab test from the record orders feature, as you can see where my cursor is, or still from the traditional. Allow me to just close this. Traditionally, we were used to the order basket. So the order basket is still there, but probably it's just a matter of time before this will be retired, because to try and just do away with the redundancies. So, but for now, you can still use both options. But what the change here is that the record orders has been added as one of the features just within the patient profile. And once you do that, it actually just gives you the same panel like it were for you to be able to order your test. For example, I'll want to just order a test here, full blood count for my patient, a complete blood count, and then I just click on the order form. Again, if for that particular test, a price, or probably it has been configured as one of the tests that a patient is supposed to pay for, a price for the test will populate. And again, as you can see, the price is actually dependent on the payment mode again, because you understand that facilities probably charge differently when a patient probably is paying out of pocket as compared to when they have to make a claim from an insurer. So yeah, that is one of the features that have also been included in the EMR. So I'll just pick this and say save order, and then sign and close. So when you click on sign and close, you'll get the message that a placed order for complete blood count has been successful. Again, in the event I'll want, let me just try and pick an order that probably is not one that I'm supposed to be billed for. So I'll come and say I want to also test this patient for VDRL. So order form. Sorry, no, VDRL also is a test that is being billed for. Allow me to choose one that is probably does not have a price, and I'll explain this later. Just the alkaline phosphate ALP. Yeah, as you can see, no price has been configured for this service. So that means that for this particular test, you remember that the EMR comes as a blank slate. So it is up to facilities to configure the different prices for the different tests, and even billable services, including both pharmaceuticals and nanopharmaceuticals. So I'll press the order and just sign and close. Now, after you place your order, if you are to allow me to just refresh, and then we go back to this particular patient's page. So Thursday. Sorry, it's taking too long to load from my end, but sometimes connectivity issues. You realize that the server is not. It's actually hosted somewhere. All right. So I'll come there and just choose my patient. So when I go back to lab orders, you'll see that the two orders now. Even when I just click on, when you get to the patient profile, you'll be able to see the two orders that have been placed for this patient. So there's the alkaline phosphate, ALP, and there's a complete blood count. So by a clinician doing this, actually the two orders have already gone to the pharmacy, to the lab, and now it's up to the lab personnel to probably attend now and ensure that they process the orders based on the availability of the sample, if the sample will be availed, and also based on the fact if probably the test has to be paid for, based also on the ability of the patient to pay for that particular test. So how do we do that? Now, assuming that I'm a lab personnel, so the lab personnel, what they'll see, again, for my user credentials have been, I have some super user rights, so I'm able to both act as a clinician and also as a lab personnel. So, but in your facilities, I hope you all remember Otieno mentioned that access to any feature is actually role-based. So, you might not be able to do what I'm doing as a lab personnel because you'll only be restricted to filling in and receiving labs and processing the labs. But now for me, the reason why I'm able to just toggle between being a clinician and being able to attend to a lab is because I've assigned myself all the rights. So I'm assuming that I've logged in as a lab personnel. Again, this is the landing page, and as you can see, this is the dashboard for the facility with the facility homepage. I'll come down to the left navigation panel this time around. This is the facility left navigation panel, and just drill down to laboratory. When I click on laboratory, I think Otieno had also mentioned this. I mean, it takes me to the laboratory dashboard for that particular day. And then by default, again, the EMR has been designed to just zero you down to that particular day. But this doesn't mean that you can't flex with the date range. Yeah? As you can see, there's a date range feature here. So if you want to probably to view more than today's activities, you can just play around with the date range. But I mean, you can decide to go even up to the beginning of the month by clicking on the date helper here, and then you just play around with it. I'm sure most of us are aware of that. But now, allow me to also address the figures that are appearing on the dashboard. One, the first figure that we are seeing is for tests ordered. So this represents the tests that have been ordered on that particular day. Or in the event you flexed with your date filter, it will for all the tests that your date range accommodates. And then now there's also statistics on the work list. So the work list actually just gives you the number of lab tests that are being worked on by the lab personnel at that point in time. So out of the 26, how many are in progress? So so according to this, there are only 3 that have already been picked. And then now also gives you the results completed. It will give you a total number of all the results that have been processed fully, and the results are uploaded to the patient profiles. So allow me to quickly again just take you through the test order. So once you come to the test orders, from still the laboratory dashboard, you will be it has also again been divided into 4 tabs, as was explained by Otieno. So the tests ordered, again, for those tests that have just been ordered. So for example, for my patient prep Thursday training, as you can see, is appearing as part of the tests that have been ordered. And if I want to attend to them, what do I do? The arrows that are facing downward on the left of your screen, just actually there are navigation buttons to help you expand and just collapse and expand a particular patient's test. So when I click on the arrow, it expands and gives me a list of all the laboratory orders that have been made. And the reason why I did 2 laboratory orders, and as you can see, there are the 2 laboratory orders that I made for my patient are all appearing here. There's one, the alkaline phosphate, the ALP, on the top, because it's the one that I ordered last. And then the complete blood count, the one I ordered first, is appearing at the bottom. Again, if you are to look at the buttons and the features, the navigation features that are appearing under each, you will see that you know that they're slightly different. Under the complete blood count, we have the option to either reject the lab request or bill. And the reason why this is so is because for all the lab requests or lab orders that are supposed to be paid for, unless they are being paid, unless at the point of the patient being checked in, it was clearly stated that they will be taken care of, their payments will be taken care of by an insurance such as SHA, and probably any other registered insurance provider in the system, you are supposed to be able to, you cannot navigate further and probably as a lab personnel and pick that particular test without that bill having been settled. I think this is just standard practice, and I mean the feature is has been put in there so that we can avoid cases where facilities are crying wolf that they offer tests and then patients were unable to pay. I'm sure it's standard practice amongst a majority of the facilities that for cash paying patients, they have to pay first before a service is offered. But again, even in the event this patient again was inpatient, this rule will relax. So the bill, you can still process you can still pick the lab request and process it. Why? Because the system assumes that the bill will be settled at the point of the patient getting discharged. But now, for purposes of this, and the reason why I picked two tests is just for us to be able to utilize one to be able to see how do we process this. So, as a lab personnel, I'll want to utilize the ALP test for just for purposes of showcasing how laboratory orders are processed. So, when I click on Pick Lab Request, I'll be prompted to confirm that that is indeed what I want to do. And as you can see, there is a message that pops up saying that continuing will update the request status to in progress. So that means they'll move from ordered to in progress. So I say yes, I confirm that. So once I confirm that, and I click on the in progress tab, you can see that the test has already been aligned here, and it's one of the tests that is available now for me to service. Assuming that I've gotten the necessary samples, you can see now the features that are available for me under this particular panel are either for me to reject the lab request. And the reason why a lab request can be rejected at this point in time is probably because either the sample was insufficient or due to one reason or the other. Probably even we have had a breakdown in the machine that is doing this. But we're also given the option now to just add the lab results. So as a lab personnel, this is where you'll go to and just click on add, and then probably just give the necessary results and then save and close. So that will save that particular lab results. And after saving, that particular lab order now transitions to completed. And as you can see again now, prep Thursday training is appearing under the completed tab, and with the results actually that I keyed in. So by and large, that is how to process, how to go through the ordering of a lab request and processing of the orders. The declined tests tab is just for all those lab orders that have been declined, like I mentioned, and I'm sure I'm just repeating what Otieno also mentioned. But one other thing that I want to point out is that even as we work on this, there's we are working on ensuring collaboration between the EMR and the lab machines through Labware. So yeah, there are some facilities that are already utilizing this, but we are hoping that I'm sure that has been a pain point, especially for a majority of our users. A test like a full blood count, which has a lot of parameters, there's a need for us to ensure that we really try and minimize the action of lab personnel entering the results one by one. So I'll pause there and hand over the mic to my brother Eric, just to proceed with the rest of this session. Allow me to stop sharing. Songok, was I audible?
Yes, you are, Moses.
Okay.
Thank you, Moses, for that. I think I thought Ogutu could go next after you.
Oh,
Ogutu,
sorry.
confirm?
Yeah, it should be Ogutu then.
That's fine. Let me share my screen. Mine will be a short one. Are you able to see my screen?
Yes, so go to your screen is up.
Thank you. I'll just showcase which looks like an overview or a recap on what Bernard Otieno had already shared when he was doing the navigation. So for me, I'll just take us through on how to do drug orders and dispensing by the pharmacists. So I'll just speak on the active patient, that is PrEP, that is training, and as already alluded earlier by both Otieno and Moses, for us to do orders for drugs. The order basket is what will be used. It is for both drug orders, lab orders. You can do imaging procedures and also medical supplies orders. So for us to do a drug order for any patient, that is where to go to. And for us to do any drug order, you just go to drugs, click on add button, then you search for the drug that you want to prescribe for this particular client. I'll use an example. Let me see. Okay, let me pick rifapentine isoniazid. This is just for demo purposes. Okay, so you click on the order form. From the order form, you'll be able to get at a glance the amount of stock you have for this particular drug. If in any case the drug is out of stock, you'll be notified under in stock. It will be in red, a drug out of stock. So for the providers, I always take note of this. And if in any case there's a drug you'd want to prescribe and it's out of stock, kindly liaise with the pharmacy so that they can update the drug if it's available in store. Or they can, or if the system issue, it can be also sorted. So for the drugs that are available in the pharmacies, all the pharmacies within the facility, they'll be able to tell you the stock, the number of tablets or the number of packs or bottles will be shown here so that you know what you have while doing the prescription. So an example, just do a prescription for this particular client. Those, let me just pick two at random. This will be tablets. The route is oral. We'll have the frequency twice daily. So this would be around, duration is 5 days. Number of tablets, let me just have it at 20. Refills none. This is TB. Then you just save order. Is 0. There are no prescription refills. So when you sign and close, when you come to so I think that is how to do drug orders. And after doing the order, the client should be able to go to the pharmacy to get the prescription. So I already have a user that has got the rights. So I will switch to a pharmacist and access the dispensing module to dispense the drug. So I will change location as a pharmacist. After logging in, you just change location or you select while logging in. I will change to main store. As you are aware, TaifaCare, powered by OpenMRS, is role-based. So depending on your role, to be able to access various modules or features. So I will head directly to dispensing app. So here I'm at the pharmacy. So by default, you'll have the tab on active prescription loaded for you. So from here, you'll be able to see all the active prescriptions that have not been serviced. At a glance, if the list is so huge, you can search for the client. For me, I can see my client is here. PrEP Thursday, which I've just ordered, rifapentine. So all the active orders will be listed here. And we also have all prescriptions tab, which will show you all the prescriptions that have been done, those that are active and those have been completed. The completed one are the ones that have been serviced or dispensed. So if you want to dispense the drugs that are ordered for PrEP Thursday, when you click on the down arrow, you'll be able to get the drug. You'll get the quantity that are ordered. From this particular section, you can pause the prescription if in case you want to get more information on the drug or you want to consult something before you dispense the drug, or you can modify the drug because of one reason or the other as a pharmacist. So other than that, you can directly go to dispense and then you dispense the drug depending on the quantity that is available and that you can prescribe. So we have enough drugs. We'll do the 20 tablets that had been ordered. And then I select from where. This is the batch that I'm dispensing from. So I'll just select that and dispense the prescription. Correct. So my client will move from active prescription to all prescriptions. Will search for the client. He'll be able to see that this particular prescription has been completed successfully. I think that is all from my end, unless there are any questions or clarifications needed. Thank you. I'll stop sharing the screen and hand over to Eric Mudomi.
Thank you, Ogutu, for taking us through the prescription and even the dispensing. Confirm that, Ogutu, can hear me?
Loud and clear.
Let me share. So again, Ogutu, confirm that you can be able to see my screen.
Yes.
Thank you. My name is Mudomi Eric, a business analyst at Palladium. I'll be taking you through now to walk through the PrEP module. Now that you've been taken through the registration of a client or even a patient, having walked through the HTS section, so I go direct to the PrEP module. I know this is what will be happening once we receive lenacapavir at our facility starting from next week, as Dr. Barbara alluded earlier when she was giving her speech. So maybe something to note, I'll start with under the consultation queues. Marianne talked about this, so I don't want to go through about it again. And looking at the consultation room number 2 will allow me to use the same client, that is the PrEP Thursday training. Why will I be using the same client? This is because for you to even enroll a client into PrEP module, there are some of the things that you need first, or the client needs to meet, even for you to be able to enroll, making this particular client to be eligible. One, the age of this particular client, and allow me as I talk to call and serve this particular patient. One is the age that we need to look at, must be equal to or above to 15 years. Number 2, we need to look at the weight, must be above 30 kgs. You can be able to see when triage was done, this is 32 kgs, the age is 26 years. Then number 3, the testing should have been done, and that should be HIV negative. And when Marianne was doing this, we could be able to tell the testing turned to be HIV negative. And then from there, now I can be able to start. Maybe to mention, when you look under the care panel, we were taken through this and told that under the program enrollments, So from here, there's where you can be able to get the PrEP program, and then we can be able to enroll. But now we can't be able to find it. Why? Because this particular client has only met the three criteria aspects that I've talked about. So we need now to go for the fourth one, which is whether the client is willing to take PrEP. And how do I go about it? I'll navigate to the clinical forms. Then from here, we'll be able to see the PrEP behavior risk assessment form. This form will only appear after you've done the HIV testing, the HIV initial testing, and this particular client turned HIV negative and meets the other criteria. So when I click on this form, I'll be able to fill it, focusing on the behavior risk assessment of this particular client, whether the sex partner HIV status is known, is it positive, negative, or unknown? And for example, if I say unknown, there are some of the things that, depending on how even the healthcare providers at the facility have been taught using the guidelines, they'll be able to tell some of the things that make this particular client to be at risk of even getting HIV, hence need to get PrEP to prevent this happening. Then the other is the behavior risk of partner. You can be able to select that will be able to apply to this particular client. Maybe has sex with more than one partner or the transactional sex, and you can be able to select all that applies. Then is this particular client receiving any contraceptive? Can be either yes or no. And then assessment outcome, depending on how you've assessed, because you've been attending to this particular client, then you can be able to tell whether is this particular client at risk or is this maybe risk low. So then allow me to say risk, and then was there any risk education that was offered? If there was any, then you can be able to specify that. And then this is a mandatory question, whether the client willing to take PrEP. We'll notice that if you say no, you need to give the reason as to why, and then you can be able to proceed and save the form, but you'll not be able to see the program, the PrEP program appearing here. So we need to give that the client is willing to take PrEP to make it now the fourth aspect of ensuring that now this particular client is eligible for PrEP. Then if there is any other preventive service that you want to refer this particular client, then you can be able to pick. Maybe, for example, prevention and treatment of STIs and even counseling on the risk reduction. Then from there, you can be able to save and close that. Once that is done, then we'll now navigate to the same program enrollment and be able now to start enrolling into the PrEP program. Just a minute. So when I get to the care panel and then program enrollment, at the bottom, then you'll be able now to see PrEP program appearing. That means now the system can be able to validate all the aspects have been met, and then this particular client is eligible. So when I click on the enroll, you'll be able to see the PrEP enrollment form. Again, this is coming as a different way of how we've been doing our PrEP initially. And this is because we've noticed in most of the setups, as we even be moving to the facility-wide system, some of these enrollments are done even by non-clinical personnel who may not be able to respond to some of the clinical variables that we've been including in our enrollment forms. So that's the reason as to you'll be able to see at this particular moment, it's just only clicking on the save and close, which will now put or place this particular client under the PrEP enrollment program. So what happens when this particular client gets into the next provider, who may even be able to record even the clinical sections, can navigate to the options or the three dots. And when you click on these, you'll be able to see the forms. So where we have all the programs, not only even the PrEP program, you'll be able to see the forms will be accessed from this particular section under the program enrollment, unlike from the clinical forms. So I know we'll be retiring all these forms from the clinical forms, but you can be able to access them from the program enrollment. So from here, you can be able to see the PrEP initiation. And when you click on the PrEP initiation, then this is the form that I can be able to proceed and give the client type. Is it new transfer in or restart? And depending on what I select, then the form has been validated. If this is a transfer in patient, then you'll be able to see more variables pertaining to transfer status being availed. But allow me to say new client. Then we have the even the restart for those who may be restarting PrEP. Maybe they interrupted at some point. Then they are coming back to restart. Then you have the population type, either general population or the key and vulnerable population. Then we need to give the unique PrEP number now at this particular moment. And the system will be able to validate if you enter an invalid number, and will be able to warn you. Then we have the PrEP initiation details, whether the client has previously been on PrEP. So if you say yes, and I'll need to mention here, then you'll be able to see type of PrEP. This is one of the enhancements that we've done by adding the lenacapavir, which is now the new drug that is coming in, or the type of a PrEP that is coming in has been added. But if it is for the first time, this particular client hasn't ever used this, you can be able to say no, and you can be able to include the adherence body by clicking on the add. Then you can be able to give the name, then the alias if this particular client has, then the relationship to this particular client, maybe spouse, and then even the telephone number we can be able to give, and the alternative phone number. Then from there, you can be able to save and close. By that, we'll now have started the PrEP initiation process. Then when you navigate back to this particular section again, you'll be able to see now us getting the PrEP initial form. We need to differentiate between the PrEP initiation and the PrEP initial form. The PrEP initial form now carries what now the clinical team, the clinicians fill for the first visit when they are attending to this particular client. The PrEP initiation, it carries more of the details which will be filled by the person who will be completing the enrollment and giving you the unique identifier and getting you now fully into the PrEP module. So when I click on the PrEP initial form, you'll be able to see the visit details, then the partner profile, whether the partner HIV, whether the partner is HIV positive, which is a yes or no. If yes, then you can give the HIV positive partner profile, but earlier indicated that was no. Then we get to the STI screening. Has this been done? If yes, then you can be able to select all that apply. And this is the outcome of the STI. Maybe there was a genital ulcer disease that was noticed. Then from there, and you can be able to select more than one. Then if it's other, then you can be able to specify. For the one that you ticked, then was it treated? Yes or no? And there is no any other follow-up question. From there, we get to the fertility intentions. And this is because our client is a female. So if this was a male, we will not be able to see some of these variables in the form because the system has been validated. So for the menopausal status, if I click, let's say, for example, it's menopausal, there are some of the things that will be hidden and you'll not be able to respond to that. But if not, then we need to look at when was your LMP and whether the client is pregnant. So give no, but if it was yes, then you'll be able to see some of the variables coming up here for you to be able to fill the EDD, whether the pregnancy was planned. But if it was no, you go direct to whether you're planning to get pregnant. Again, can be either yes or no. And if at the moment you are breastfeeding, maybe yes or no, let me pick yes. Then you get now to the family planning status, whereby if you're not using, you'll notice nothing happens. But if on family planning, you need to specify the method. And again, for the same, for if you want family planning, you need to specify the method that you want to start using. Then we have the other part of the adverse drug reactions. Is the client has adverse drug reactions? If you say yes, then you need to click on the add here, and then you can be able to give the medicine that is causing the reaction. We have a list from there. Then the reaction itself, we have options to select from. Then the severity, again, options to select, and then the date of onset and the action that was taken. If there wasn't, then at this particular point, you don't need to add, but to say that there was no any adverse drug reaction. Getting to the lab investigation section. So this just to confirm whether was serum creatinine done. If you'll be doing it, then you can be able to say yes. You will navigate to the order basket and be able to order what Moses was showing us. Then we have the PrEP status from here, whereby you're looking at the signs and symptoms of acute HIV. Remember, above the 4 that I mentioned, there are some of the things that are looked at for you to be able even to proceed in hitting on PrEP. On PrEP. So signs and symptoms of acute HIV, this is either yes or no. And you'll notice that when I say yes, automatically the system discontinues the starting of PrEP, because if there was any signs and symptoms of acute HIV according to the guidelines, you're supposed to probe further and first stop initiating PrEP. But I'll say no so that I can be able to proceed. And whether adherence counseling was done and the outcome. Then was there any contraindication for PrEP? Again, from here, when you say the same confirmed HIV positive, or you give a renal impairment or less than 30 kgs, the system will alert that the PrEP treatment plan will be discontinued, that you cannot proceed. So allow me to say none, and then give the PrEP treatment plan as start. So here you can be able to state whether you are starting, and we'll only be able to see start because it is at the initial. For the other forms, you'll be able to see, you'll be able not to see continue, restart, switch, or discontinue. So at the start, then you'll be able to say the reason for starting PrEP. And then you'll be able to see a list. You can be able to select depending on what this particular client presented with. Then the prescribed PrEP today. When you say no, you'll notice there's nothing that will pop up. But when you say yes, some more question now will be able to show up. There's another enhancement that we've done to this particular form. For those who've ever used it earlier, we've now included the dosing strategy, and the dosing strategy will include daily oral PrEP and the long-acting PrEP. And this is for the female. If my client was a male, you'll be able to see event-driven being one of the dosing strategy. So the system is again validated. That's the reason as to why I can only be able to see the two. That is the daily oral PrEP and the long-acting PrEP. And if I pick daily oral PrEP, I need to give the type of PrEP. We've aligned these as per the guidance. So when I click on the oral, you'll be able to see the regimen that I need to prescribe. It says TDF, TC, TAF, FTC. Now again that we're bringing in here, and then the TDF, FTC. So this will be able to align depending with the client that you are working on. If this client was a male, we'll be able to see difference here with only TDF and TDF 3TC and TDF FTC appearing. So the system has been validated. But allow me to talk on the long-acting PrEP, because this is now what we will be even showcasing how we are even prescribing and dispensing to our clients. So when I click on the long-acting PrEP, the type of PrEP changes to Cabele, the Pivring ring, or lenacapavir. So from here, which one will you be initiating your client to? So if again I say Cabele, you'll be able to see just number of months. And even for the lenacapavir, nothing comes in, just the number of months. And we know it is twice in a year, so I'll give 6 months. And then was there any condom that was issued? When I say yes, I need to give the number. And then from there, I can be able to give, to say whether I gave the next appointment date. And then you can be able to click on the add appointments and then give an appointment. So next, be coming for PrEP follow-up. Then I select the date. Probably let me give 19th of August after 6 months. Then the system will be able to show you on that particular day how will your clinic will be. Then this will be scheduled for the status. This is the provider, and then this is the date, appointment, or schedule. Then I can be able to save and close. Then from there, I can be able now to save this particular form. So having filled even the PrEP initial form, then from there, I can be able to order any of the lab tests. If maybe the serum creatinine, I will be doing it right now. If not, then I can be able to proceed to the drug ordering. So at this particular point, because today we were not showcasing on the stock management module, I have already received lenacapavir in our stocks module, and now I'll be able to demonstrate how can I be able to prescribe that and dispense deducting from our stocks. So I'll be quick here because Ogutu talked about this. So I'll just click on the ad, then search for lenacapavir. Just a minute. Allow me to refresh.
Just give it time to load.
Okay. Okay, sorry for that delay. So once you select, you'll be able to see lenacapavir, and then you click on the order form. Then you can be able to tell from your stocks what you have. So there's what I have in the stocks from the main pharmacy, and even the main store, and the pharmacy that is named main pharmacy Chuka, and I can be able to see in terms of packs. Then I can be able to prescribe, because it will be issued in terms of packs as per how we've been guided. So it will be one pack. Then the route, subcutaneous. Then the frequency will be 6 every 6 months. Then if there is any patient instructions, you can be able to give there. And then this is the date when we are raising our prescription. Then the duration will be 6 months. So you need to drop there. Months. Then quantity to dispense will be 1 pack for this particular one client. No refill. And then you can be able to give the indication. Once you've done that, you can be able now to save. Then you'll be able to see your prescription, and you can be able to sign and close. So once that is done, you'll be able to get a notification that that was successful. Then from there, now you can be able now to assign this particular patient to the next queue, which is the pharmacy. But before I do that, allow me to get back to the care panel and show you what happens when this particular patient comes into the subsequent visits. So again, once you pick this particular, you get the patient chart, you'll navigate to the care panel, you click on the program enrollment, you'll be able to see your program there. again, you'll be able to utilize the options, the three dots where my cursor is. Then when you click on that, you'll be able to see other forms popping up. So you'll be able to see the PrEP follow-up form. Allow me to show some of the difference with the earlier one that we had. So this one you'll be able to see, again, starting with STI screening, as I mentioned that, the fertility intentions. If yes, attain menopause, it will be able to close all other variables, but if no, you'll be able to see the LMP, whether is the client pregnant, and if yes, then we'll be able to close some of variables or questions asking about family planning. But if it's not, then we'll be able to proceed with whether you're planning to get pregnant. Maybe if yes, then are you breastfeeding at the moment? Whether yes or no, then you'll be able to give your family planning status, just as I showcased in the initial form. Then you'll be able to see the adverse drug reactions, not different from what I showcased. When you say yes, you click on the add, then you can be able to add them. Then you get the PrEP status. This is where you can be able to get some of the difference. Again, at this point, when you say yes, the system will alert you to discontinue. But if no, you can proceed again with the adherence counseling, as I had talked about it earlier in the initial form, and even the contraindication for PrEP. Where we have the changes is the PrEP status. Now you'll not be able to see start because this is a follow-up. What you'll be able to see is either you are continuing with the PrEP, or even you want to restart, and this is for those who were stopped at some point, or you want to switch. And if, let's say, for example, it says switch, and I say I want to prescribe today, then I'll be able to see the dosing strategy. The same for the restart or even the continue. And the dosing strategy is the same as what we talked earlier in the initial form. It has two responses with the daily oral PrEP or the long-acting PrEP. When I say daily oral, then I need to select the type, and then I select the regimen. If it's long-acting PrEP, then I'll be able to see the type of PrEP being the Cabernet, dapivirine ring, or lenacapavir. Then if I select on this, then I need to state the number of months, and as we have done earlier, then whether you issued condoms, and then the next appointment. So you'll be able to see the only difference between this form and the other form is specifically this particular part here, whereby if even we are switching, we'll need to give the reason as to why we are switching this particular client from one regimen to the other regimen. This is what you'll be able to see for the PrEP follow-up. And again, the other visit, you'll be able to see the monthly refill. And I know these forms do not have many differences in the what the forms do carry, but just what I was explaining on the PrEP treatment plan, the same will appear. When you say switch, you need to give the reasons, and you'll be able to see reasons appearing for you to be able to state the reason as to why you're switching. So that is when it comes to the clinical forms for this particular PrEP client. How do we now, we've raised even the, the prescription. How do we dispense? Once you will need now to queue this particular patient. Once you queue, you'll navigate to where we have this is something which is configurable at the facility level for you to have pharmacy. So I think the server that I'm using has not yet been configured for that, but I can demonstrate because the moment you raise the prescription, the name of this particular client will end up being at the pharmacist desk. So when I get home, the pharmacist, number one, will need to check your location as a pharmacist. So I need to change this. I have stocks in the main pharmacy, Chuka, or even the main pharmacy. So allow me to use that. Then need to confirm. So as a pharmacist, you need first to check. You need to be in a dispensing location for you to be able to even get the batch number from the stocks. Then from there, the easiest way, just click on the left navigation panel, click on the pharmacy, which will take you direct to the dispensing platform. So from here, I can be able to see my client here and the prescriber, and I can be able to see even the drug, the lenacapavir. So when I expand, and I know this, we were shown on this Then you'll be able to see lenacapavir here with the instructions that were there indicated during prescribing of this particular drug. Then I can either close, pause, and modify. We were taken through this, but allow me to talk on the dispense. When you click on the dispense, you'll be able to see this information for this particular client. This is the drug that you want to dispense. The quantity that was prescribed was 1 pack. So here, if you want to give, you can be able to give 1 pack. And the reason I say this is editable, it's for you. Maybe what was prescribed may be more than what you want to dispense, so you can be able to utilize this quantity to put what you want to dispense. Then this is just read-only coming from the clinician. You can be able to see 1 pack, the route, the frequency. You can give your own instructions as a pharmacist. Then this is the date when you are doing the dispense, the name of the user who is dispensing. So the reason as well you could be able to see my name here and even on the forms which are used by the clinical team, the clinicians, it's because of the roles. I was assigned more than 1 role for this particular training, but at the facility level, we'll be able to give you a role that pertains to what you do at the facility level. So when you look at the stock dispense, then you'll be able to see a batch. This batch is coming from our stock management module, which can be able to manage your stocks and give you even the stock reports when you request in the system. And you can only be able to see this batch once you change the location. You need to be in a dispensing location, and that location needs to be having stocks. Then from there, you can be able to dispense that particular prescription, and it will move from active to all prescription. So I think that's all. Having taken you through all that. But again, once, if you would like to see what you feel, you can navigate to the clinical encounter section here, click on the visits. Then from here, you'll be able to see all the visits, today's visits. You can either expand these, and timeline will give you all what was done, all the providers who filled each form. And if you want to see any of these forms, to see their summaries, you can click on the encounters, then you can be able to expand and you'll be able to see all that which was recorded, and you can be able to edit if need be. I think that's all from my end. Back to you, Songok.
Thank you. Thank you very much, Eric, for taking us through the workflow. I wanted to usher in through the dashboard, the mockups. And then first and foremost, Mary-Claire will take us through the DORP process. And then Lilian Ligola will take us through the dashboard. There's some dashboards that we've developed. It's work in progress. So we just wanted to give you a quick highlight on what we've been able to do. Then after that, very quickly, Otieno will take us through the SOPs and probably where to access basically the SOPs and the short videos for purposes of just refreshing ourselves at the facility level. So Mary-Claire, I don't know whether you'll start first or Lilian. I think Mary-Claire will go first.
Yeah. I'll start first. Just a minute, let me share my screen. Okay, so I'll be going over data transmission. So as been mentioned before, there are some additional variables that have been added to TaifaCare, and we will need to transmit them to the data warehouse. So the DORP data sets, such as the patient extract or PrEP behavior, have been updated with the additional variables. So these are just the lists of the variables that have been added in DORP. Type of PrEP, which would contain, for example,
lenacapavir, and amongst other options. And there'll be dosing strategy, other reasons for PrEP, date of switch, and so forth. So these are all the variables that will be added and collected. And if you want any more information on them, you can just find them in the PrEP dictionary. So these variables will be transmitted using the next version of DWAPI, which is to be released soon. So there's not much change in the process of transmission. So what you'll just be doing is once you're logged into TaifaCare, you'll navigate to the KenyaMR home and and go to the ETL section, and you'll just refresh the tables. Once you're done with refreshing the tables, that's when you can go to the DWAPI side and load and transmit the additional PrEP variables that have been added to the data warehouse, where it will be ETL'd and processed in preparation for the analytical work to be done on it. So you'll need the new version of DWAPI and KenyaMR. So on the transmission side, it's very simple, and that's all that's there to it. There's not much other procedure that you have to do. So I'll end there and pass it to Lillian to present on the PrEP dashboard monitoring. Thanks.
Good afternoon, everyone. Let me share my screen. I hope you can be able to see my screen. So my name is Lillian. I'm going to take you through the above site dashboards that will be used for monitoring PrEP at the national level. Please take note that this is a mock-up. So it's just like what we expect to see, but there's no much navigation that I can do to this. So on this PrEP dashboard will be part of the case surveillance work stream. As you log into the PrEP dashboard, this is what you're going to see. We will have on the left, we will have filters based on the assessment period, the county, sub-county, facility, sex, age category, agency, and partner. Then there'll be a button down there that you can use to apply the filters. Then we will have two main tabs, that is the PrEP initiation enrollment tab. Then there's the PrEP seroconversion and PrEP switch. So for the PrEP enrollment tab is where we are at right now. So on this, we'll be able to see the PrEP new pregnant women, then the PrEP new breastfeeding women. Scrolling down, you'll be able to see the PrEP enrollment by dosage strategy as showcased here. Then on the right side, there's a PrEP enrollment by dosage strategy. That is the long-acting PrEP, daily oral PrEP, event-driven PrEP with a specific regimen and the number of patients. The same will be disaggregated by county and partner. Then we have the second tab, which contains the seroconversions and the switches. So the first card will show us the number of the total number of seroconversions, then the total number of PrEP switches. When we move down, then we're able to see the seroconversions by PrEP type and also the seroconversion by regimen type. Then on the right side, we are able to see the PrEP regimen switch, the different switches from the different that is from the long-acting to event. So you'll be able to to filter out the period that you want, and it's going to show you the exact number of transitions from one regimen to the other one. I'll want to end it at that. This is just the version 1 of our mockup. So probably this is what you'll see first as we continue to integrate more indicators. Thanks, and over to the next presenter.
Thanks, Lillian and Mary Claire for taking us through the DWAPI, and of course Lillian taking us through the the mockup. That's basically what we are looking at. It's work in progress. We'll be able to just finally, the data that you're seeing there is not accurate data. It's just dummy data that we're using to visualize as we continue doing the modeling. So Otieno, very quickly, can kindly take us through the next bit, and then I'll take you through the call to action, and I think that should be it. Otieno, I can see our dropout rate is quite high.
Okay, so Sungok, confirm if you're able to see my screen.
Yes, I am.
Yeah, so I think this is going to be a short one. So just to ensure that you are all supported in terms of capacity to utilize the new version of TaifaCare, and also to ensure that you're able to go through the PrEP workflow that we have been taken through in light of the activities that are going to follow this particular training. We have our list of resources online that can help you get started, that you can do on your own. So these are all self-learning resources that you can utilize. So we have the SOPs and the training resources on that link. Feel free to take a picture of the screen. I'll also post the same on the chat box. So we have the training resources in that link. We have the YouTube resources. These are just short videos that would help you get up to scratch in terms of utilizing different components of the TaifaCare system. Also, you are also encouraged to participate in the FAQ platform. So the FAQ platform is our Kenya GMS community platform, where you can ask questions and also get your questions answered. You can also participate to answer other members of the community. Lastly, we have the service desk line. I've seen guys asking certain questions from the chat box. You can utilize this line to reach out for technical support to our dedicated service desk that will be able to respond to your questions. So maybe I could just take this opportunity to show the okay, I'll still share my screen. Sorry for that. Yeah, so this is the website where you can get the SOPs. When you come to kenyahms.org, then you come to resources. When you come to resources, you'll be able to now interact with these resources. Of interest is the HIS learning resources, where we have a list of all the SOPs that you'd want to interact with. PrEP service documentation is here. You can always just open it up and just go through it to just understand the process of documenting the PrEP. And also our test instances are here. Feel free to log in using these credentials so that you can practice on your own. These are test instances, so feel free to post any data just for your learning purposes. Again, also, you can interact with our YouTube, again, through the same platform. When you click on this, you'll be able to go to our YouTube channel. And the first video that you'll see is the how to navigate PrEP module in TaifaCare. This kind of summarizes what Eric Mudomi has just taken us through, so that you can learn how to document your way around LenPrEP and how to document the lenacapavir so that you are able to understand how the workflow works. So these are self-learning videos. Feel free to interact with them. Again, also for this session, it has been recorded. We'll also be posting it online this evening. So from tomorrow morning, if you missed it or your network had issues or you didn't get something, you are free to log into our website, our YouTube channel. You'll get that video so that you can go through what we've just seen today. Yeah, otherwise, that's all I wanted to share. Back to you, Samuel.
Yeah, thank you. Thank you very much, Otieno, for just guiding us on where to access some of those very, very important resources as we continue implementing this. So very quickly, I'll just request for 2 minutes of your time and to take you through our requests, our calls to action, basically. What do we expect from your end? Otieno, confirm you can see my screen?
Yes, I can see.
Yeah, thanks. So remember, like Barbara mentioned, and I think she was able to just take us through the list of the counties that would be rolling out PrEP for phase 1. Those are the counties, and these are the counties that are here. And like I said earlier, we will be interacting with the other counties tomorrow, the 5 that are remaining. I know some may have attended this meeting, which is still okay. And kindly at this point, if there's anyone who probably missed out, kindly ask them to join us tomorrow, because we'll still be able to take you through the same training materials that we've just taken you today. So we've also, of course, working closely with the county teams, we've been able to select. They've been able to select sites per county. Some have picked 10, some have picked more than 10. As long as you're able to support those facilities, I don't think we really have a problem at the national level. So the expectation is that we will be sharing the new patch, the release patch, of course, that would help you to be able to upgrade. So we'll be able to share the package with all the teams, hopefully before close of business tomorrow, and we are urging you to help in terms of ensuring that you upgrade all the sites, because once the launch is conducted next week, and I think all of us heard what Dr. Barbara said, next week on 26th at Riruta. Once the launch is off, then by that time we are hoping that all the facilities that you selected will have received commodities. So we'll expect that we should be then be expected to start dispensing. And remember what Barbara said also, we are leveraging on EMR. So that means all the sites that were selected are EMR sites. So we are not currently going to go to any paper sites. So it's very important for us to ensure that we upgrade our sites, both the EMR and of course DWAPI, for purposes of transmitting data to the national data warehouse. So this is where the county health management teams, the sub-county health management teams, and the facility in charge will play a major role, of course, working closely with service delivery partners. So we are requesting that you prioritize, once the release, the package is out, we are requesting that you prioritize the upgrade to the selected 10 or 15, or whichever number that you selected. I know yesterday when we were sending out the communication, we were able to share with you those facilities. If you have any other reservations, you can always reach out to the program people. So the county health management teams, we expect that you'll be able to provide leadership and oversight during the rollout period. We are urging that for the cloud sites, once this is sent out tomorrow, the expectation is that by Monday 23rd, you should have been able to start and conclude the upgrade. And for the sites that are on premise, the expectation is that they should be able to have completed the upgrade by, sorry, that must be a typo. That should be on Wednesday 25th, not 15th. Sorry for that. That's a typo. So the other request is that facility staff should be able to use the enhanced PrEP module as soon as it is upgraded. Remember, this is what we will rely on for purposes of monitoring. The ongoing training recording will be uploaded to the YouTube channel. I think Otieno has already mentioned that. You can also be able to access the training materials and the SOPs, and all of them have been updated to reflect the current changes. We'll be monitoring the upgrades using the dashboards in the National Data Warehouse. Remember, that will be our only source of accessing this data. We are hoping that also by next week we should have the final version of the dashboards to enable us monitor the upgrades and also the data that will start streaming in. We are leveraging on case surveillance. I think that was also mentioned on the case surveillance dashboard. So that means we will be expecting to be monitoring data on a daily basis, and remember, this is very critical. Our DG will be following this very closely. So we are really requesting that we work closely with all the stakeholders at the county and the facility at the sub-county level to be able to realize this. So in terms of monitoring, I think I've mentioned that we'll be closely monitoring the upgrades, and we'll be using the National Data Warehouse to be able to check on the sites that have been able to run their upgrades. The service desk number, in case you have any challenges, I think that has been shared several times, but we won't tire sharing again, just in case you missed out. You have any challenges, always reach out to the team. We've also organized ourselves at the national level, such that from the Palladium end, we'll have a contact health informatics team who will be providing continuous support, either remotely or physical. And these are the contacts of the officers who will be supporting each of the regions. So for Kilifi, Mombasa, and Kajiado, we have Moses Care, and that is his phone number and the email address. For Machakos, Nairobi, Kiambu, Mary Ann will be available to support that, either in case or in situations where you require any of the officers to visit you physically or to support physically or in person, really. So just reach out to the team. You'll be able to work closely and organize for that. Kisii, Homa Bay, Nakuru, Siaya, Bernard Ajwang will be available to provide that support. And for Kakamega, Kisumu, Migori, Uasin and Busia, Frida will be available to provide the in-person and, of course, remote support. So right from tomorrow, we'll expect that we'll hit the ground running once we share the new package for upgrade. From next week, we should start then monitoring the upgrades from our facilities. Otherwise, I think at this point, I don't know, Diana, whether you have any comments as we close. Maybe you can also just re-emphasize on our calls to action, Diana.
Thanks, Songok. I think you have covered a majority of it. Just to reiterate that by tomorrow we may not put the release package in GitHub because we are doing a targeted approach. So we will be sharing that to the 15 specific counties. So that is both for Kenya EMR and also DWAPI. So both need to be upgraded at the same time so that the data can start streaming in. So the only one point of monitoring what's going on, and I believe even the counties in the call have credentials to the case surveillance dashboards. They'll be in a position to also just see the performance for their counties at different levels. So we can just re-emphasize and ensure that the counties, we can reshare the list of facilities in those 15 counties so that the upgrade is just targeting those facilities and those in those counties. So like Songok said, if there's a team that needs to join today's meeting, training, they are free to join tomorrow. We'll have a repeat of the same. I know we had a particular schedule, but NASCOP will be sharing another link for tomorrow at 9 a.m. So that's all from me, Songok. Back to you.
Thank you. Thank you very much, Diana, for the sentiments. So I think at this point we have come to the end of our training. But before we close, I know we have our colleagues from the program, Ruth and Paul, who've been with us in this call, sitting in on behalf of Dr. Barbara, who had another engagement really. So all right, I've seen your comment, Mike. Just give me a second. I read what you have posted. Please comment on EMR Chibabu integration. So I think discussions around integration, Mike, we may not really be able to cover that in this particular meeting, but we'll be able to provide you some further guidance on the same, but we may not really have a direct answer to that. Right, I don't know whether there's any other comment before I usher in Paul and Ruth. What's the difference between PrEP monthly refill and the follow-up forms, and which one should be filled? Eric, do you want to quickly comment on that?
Yes, so when you look at the forms, we utilize the forms that they were from the guidelines. So the difference there is the clinical aspect that you'll be able to see in one, the clinic follow-up form, and like for the refill. When a refill is being done, there are some of the variables that you'll not be able to see in that particular form. So in terms of the clinical questions in those forms. How about you?
Yeah, thanks. Then I think there was also another question from Geoffrey Kiriswa, asking why do we have to refresh the page in order for the PrEP enrollment program to appear?
Yeah, again, not all the times, but we've seen that, and it's something that we've tried to work on. Even for those who've been using the system there before, there is a time when you could be able to refresh and the patient summary could not be able to show anything. But right now that has been fixed, and they can be able to try it with the version that will be released tomorrow.
Thank you. Thank you very much. I know I may not have really gone through all your questions, but I just sampled a few. If you have any other questions, you can always reach out to the service desk team, because I think our attrition rate has really been too high. So say a word on behalf of the program as we come to the close of our training. And as from my end, this training, looking forward to meeting your team members or other team members tomorrow morning in our training tomorrow. So otherwise, thank you, and over from my end. Ruth or Paul?
Thank you, Paul. Thank you, Songok and team, for that good presentation. It was quite enlightening to see that now we have PrEP in TaifaCare, and I think we'll be engaging. And to remind the teams from the facility, we are rolling out this in 10 facilities initially within 15 counties. And this is highly monitored in all the facilities. So each facility will be accountable for every commodity that is given to them. So make sure that you document properly and you report on time. As you've seen in the dashboard, they will be tracking on a daily basis. So make sure your reports are up to date. Paul will chime in on my computer.
So thank you very much, Sangok and the team, for that wonderful presentation on TaifaCare. It's very informative, very interactive, and very simple and easy to follow. I think all the healthcare workers who are here however, I can see attrition rate is about 60%.
Paul, move closer to the mic, please. We are struggling to hear you.
So thank you very much, Sangok and the team, for that presentation. It is very clear and very informative for all of us who are supposed to provide these services to the clients. Yeah, I can see TaifaCare symbol, and it is easy to follow. And one of the things I just want to comment that we will continue interacting and interrogating some of the information, because we can see some populations. For example, if you want to follow up and pull some data, I just give an example of maybe vulnerable population. We want to pick data for that, or we want to look for key population, or AYP, or pregnant breastfeeding mothers. Those are important cohort. But based on what I've seen, we have actually addressed GP, that is general population, and also KVP. So we just continue interacting more to see how those population can be segregated and be able to get information based on those typology. Because some of them are actually a high-risk population whom we are targeting for pre-exposure prophylaxis. However, thank you very much, and I take it back to you.
Yeah. Thank you very much, Ruth and Paul, for the support that you've always provided from the program perspective. Otherwise, I want to just finally take this opportunity to say, see you tomorrow. Have a blessed evening. Thank you and bye.
Recording stopped.